The aim of this presentation is to present the main features of the pricing and reimbursement of cell and gene therapies (CGTs) in Switzerland. The main differences between the different processes are explained. In principle, we must distinguish whether it is a pure CGT product or whether the application of the product depends on a medical procedure, which ultimately corresponds to a combination of a medical procedure with a CGT product, e.g., CAR-T. The pricing and reimbursement pathway for a pure GCT product follows the principle of a conventional drug. Process B, assessment of efficacy, appropriateness and economics, whereby external and internal reference pricing is considered. At the end, the product is listed on the positive drug list, SL, with maximal prices. In addition, off-label coverage may be possible on a case-by-case basis. In the case of birth defects, the route is identical, Process C. Except that for patients under 20 years of age, payment is made from disability insurance and not from health insurance. The tariff process A deals with a CGT product that additionally requires a medical procedure and depends on it, e.g., CAR-T therapies. In this case, the coverage obligation is laid down in KLV Annex 1. The price is negotiated between the hospital, health insurance company and manufacturer, whereby an analogous DRG tariff together with a possible add-on payment can serve as a basis. This slide deals with the main differences between Pathway B for a sole CGT product and Pathway A for GCT product in conjunction with a medical procedure. To make it easier to understand, we call Pathway B as mono and Pathway A as combo. The main differences between mono and combo are as follows. Mono has a maximal price, whereas the price is not fixed for combo. Mono prices are uniform throughout the country with a 90% reimbursement level. The combo prices depend on the tariffs negotiated between providers and health insurers and may vary between cantons and hospitals. A legal challenge is possible for Federal Office of Public Health decision for mono but not for Federal Department of Home Affairs for combo. Health insurers have limited influence over mono's pricing. For combo, however, they can have a significant impact on pricing and collective bargaining. This slide lists the cell and gene therapies approved and reimbursed in Switzerland until May 2022. Between 2017 and 2021, 11 cell and gene therapies were approved by Swissmedic. 9 out of 11 products will be refunded. 2 are limited to centers or are still under investigation. The reimbursement of 6 therapies was carried out according to the product, mono, pathway. 5 according to the product and procedure, combo, pathway, mostly for CAR-T. 3 out of 11 products require multiple dosing. Of the 11 products, 4 are gene therapies, 4 cell-based gene therapies, 2 antisense oligonucleotides and RNA, and 1 is finally tissue-engineered product. In summary, most cell and gene therapies are approved and reimbursed in Switzerland. There are 2 different P&R pathways depending on whether a CGT therapy depends on a medical procedure or not. Tariff process A takes longer, requires broader stakeholder involvement, but offers more flexibility in pricing. However, there is a risk of coverage gap and risk shifting to providers. Health insurers have an increased influence on P&R decision in the tariff process A, e.g., CAR-T. The aim of this presentation is to present the main features of the pricing and reimbursement of cell and gene therapies, CGTs, in Switzerland. The main differences between the different processes are explained. It is a snapshot of April-May 2022 without claim to completeness and correctness. Comments, additions, and corrections are welcome. Thank you for your interest and attention.